Let me tell you about pneumothoraxes, or I feel like it should be pneumothori if it's plural. I don't know. That's just what makes sense in my brain. A pneumothorax in short terms is a collapsed lung. When the lung is collapsed, air fills this pleural space, as you can see there, and that lung is kind of compressed by that air. It's trapped in there. There are a couple common causes of pneumothoraxes. One is like any sort of injury to the chest, car accidents, someone getting impaled by something. Lung disease also puts people at more risk for pneumothoraxes. Sorry, it should be pneumothorax. I swear. Ruptured air blisters, honestly, I have never seen that be a cause. Not to say that it's not a cause. I just don't think it's as common in the hospital setting, maybe. Another big one is mechanical ventilation. Sometimes if we're using a lot of extra pressure, a lot of extra PEEP to help expand those alveoli, if there's too much pressure in there, the lung can pop. The main symptoms that you'll see for patients with a pneumothorax are chest pain and difficulty breathing. They may have low oxygenation stats. They may look like they are in respiratory distress. Here's a quick x-ray picture of a pneumothorax. You can see on this side all of these little kind of spider web looking thingies. That's normal lung tissue. And then over here you see a lot of black. Black is air. So where's the lung? There are a couple different pneumothoraxis treatment options, including observing the patient, keeping an eye on them. Needle aspiration, where you take a needle and just go in and relieve that air or allow the air to come out, chest tube insertion, and then a non-surgical repair or surgery. Typically, patients with a pneumothorax, most of them are usually being observed in the hospital for about 24 hours, especially if they got any sort of intervention or if that pneumothorax has caused any sort of problems with the patient. For example, like they've needed more oxygen, difficulty breathing. So that's just a quick rundown on pneumothoraxes. Let me know if you have any questions.